So I want to welcome everybody to our data workshop on the Health and Relationships Project, our HARP data. And I want to invite all of you to join the network on aging sexual minority populations. If you're not already a member, there's a QR code there for you to join. The network sponsors events like this and talks, but it also has a pilot project award for research projects. So please look into that if you're interested in analyzing these data or other data on aging sexual minority populations. So let's just get started so we have plenty of time for Q&A at the end. Let's see. All right, so today we're going to start off. I'm going to tell you a little bit about the history of the HARP project. It's important to know that to understand why we collected the data the way we did it. And then Sarah Mernitz is going to talk about the data structure and response rates and so on. And then Ewen Wang is going to talk about the longitudinal survey data. And Michael Garcia will talk about the longitudinal diary data. And we'll save as much time as we can for questions in case you have specific questions about the data. So where did this project come from? This project started in 2015. Ren Rizek and I did an in-depth interview study in the Boston area on long-term married same-sex and different-sex couples. And this was supported by the Robert Wood Johnson Foundation. And that in-depth interview study helped us decide what kinds of questions we wanted to ask in the diary and survey data. So in 2015, we also got support from NIA to collect the Time 1 survey and the diary data. And in 2020, we applied for and got funding to do a Time 2 and Time 3 follow-up. So this is how we ended up with 3 waves of longitudinal data. Unfortunately, like a lot of other NIH projects on sexual minority populations, our project was terminated in 2025. And even though we got our funding back a few months later, it did truncate our final data collection efforts. Luckily, we were near the end of data collection for T3 and our response rates were pretty good, but we did lose some cases because of that termination. I could spend a whole talk talking about the politics of this project from the beginning to now, but we'll save that for another day. So it's really important to understand the theoretical framing behind this study to understand why we structured the data the way we did. So we work from a stress and life course framework to think about disparities in health and aging in sexual minority populations, how exposure to different kinds of stressors over the life course shapes your health trajectories, and more specifically, how relationships fit into that. So obviously stress can impose strain on your relationships, but close social ties, perhaps particularly the marital tie, can buffer stress or even prevent it from happening in the first place. So we're really hyper-focused on relationships and trajectories of change in health and well-being over time, which is why we have this longitudinal component. We're also very focused theoretically on gendered relationship dynamics. We know from decades of research with high quality data on straight couples, spouses influence each other in a variety of ways that shapes their health over time. But in straight marriages, men and women tend to influence each other in different ways. For example, with women doing a lot more emotion work and health work than men, with implications for their mental health and physical health over time. But this raises all kinds of questions about same-sex marriage. And because we didn't have longitudinal data on legally married same-sex couples, we weren't able to look at that in the past. We also use this gender as relational theoretical lens to think about men and women bringing different cultural experiences of gender into their relationships, but the way they enact gender depend on whether they're interacting with a man or a woman. And in all of our studies to date, it has really mattered. Sometimes dynamics are driven by your gender, sometimes by your partner's gender, and sometimes depend on whether you're in a same-sex or different-sex union. So we very much wanted dyadic data to get into this interactional component. And so that's why we have both spouses in gay, lesbian, and straight unions so we can look at this relational dynamic. And our longitudinal data began with people who were 35 to 65 years old at time 1, which means by the end of time 3, they were 40 to 75 years old. All right, so again, to understand why we have the sample we have, you have to think about the historical context. In the US, marriage equality was passed in 2015, but we really wanted to look at long-term, stably married couples like they've done for straight people for so long. So we decided to launch our study in Massachusetts, which legalized marriage in 2014. So we went to Massachusetts to do our in-depth interviews and then to identify people to recruit for our survey and diary data components. We were very old school. We went to the Massachusetts Vital Statistics Office and we collected information on same-sex married couples who fit the requirements for age and relationship duration. So we looked at people only 35 and older, people who'd been legally married at least 3 years. We then got those folks to refer us to other couples, same-sex and different-sex couples. We also used demographic household rosters in Massachusetts, which helped us to find different sex couples who were matched on our same-sex couples in terms of zip code, neighborhoods, to get as much comparability as possible. In the end, we have very comparable groups, gay, lesbian, and straight couples, in terms of average age, relationship duration, and socioeconomic status. The average age was around 50, and the average relationship duration, combining cohabiting and married years, is about 15 years. Only 43% are Massachusetts residents. That's partly because a lot of people came from other states to marry in Massachusetts, and partly because a lot of our couples are referred by our original respondents. So what do we have in the HARP data? You'll be hearing more about the content, but you can look at how spouses influence each other's mental health, physical health and health behaviors, how they care for each other when they're sick. You can look at stress, social engagement, coping, and all kinds of relationship dynamics. And we've published a lot of studies with the first, particularly time 1, but also some with time 2. But the world is wide open if you want to look at the 3 ways of data. There's a lot of data to exploit here. So whoever gets there first gets to do that because the data are now publicly available. So before we move on, I want to acknowledge the incredible amount of effort our study participants put into this, because the 10 days of diaries and the surveys at 3 time points was a lot to ask of folks. And of course, I want to thank our funding sources, the Robert Wood Johnson Foundation and NIA, and my vast research team, which I couldn't even put all their names up here. Over the past 10 years, a lot of people have been involved in this project and made it possible for us to carry on. So and now I'd like to turn this over to Sarah Mernitz, who's going to talk about the structure of the data and a little bit more detail about those sorts of details.
Hi, everyone. Thanks for coming out to hear about HARP. We're really excited for this data set, and we hope to share our enthusiasm with you. Today, I will be talking about the data overview of the project. I'm only going to highlight some information here. I will give you a link to our website where we have a lot more information there to help you decide if this is the right data set for you to use in your own projects. Deb went over this briefly, but if you came in late or if you want a refresher, just know it's dyadic data, it's longitudinal, it has same-sex and different-sex couples, and it has 2 components, baseline and diary. It's also a sample of midlife people and not newlyweds. So just to clarify that, these are people who have been together for a while. This is the big overview of HARP. So Deb talked about the interviews that happened prior to the data collection. I'm going to be focusing on the quantitative data piece that's at time 1, time 2, and time 3. But I also want to plug a little supplement project we had as well. They collected data from 60 couples. This is qualitative data, another interview with people who identify as bi plus, so bisexual, pansexual, any similar terminology, and their spouses or partners. So that has also been collected if you're interested in that as well. The sample composition at time 1, it's a relatively privileged sample in terms of race, ethnicity, and SES. I will say that we've done a lot of work to help our sample become comparable to other samples of married couples in like the ACS and similar data sets. So it is reflective of married couples at midlife who tend to be more privileged, but this is just a caveat when you are working with the data. Our sample is similar at T2 and T3. We've done some initial attrition analyses just to make sure we weren't disproportionately losing folks. So it remains fairly similar and robust at the later waves as well. So getting to the good stuff, the retention rates. Typically, our women married to women tend to be best overall at and most motivated at completing our data set. These are for married couples only. So we do have data from divorced, separate, and widowed people in HARP. Unfortunately, or fortunately, depending how you want to look at it, we don't have these sample sizes to really do meaningful analysis with them. So the data that's publicly available is coming all from these married couples. So our baseline and diary rates are pretty good. At time 2, they decrease a little bit for T3. Deb mentioned that the loss of our NIA funding temporarily kind of inhibited some of those. But I do want to note that these are still pretty good, particularly because the diary rates I've calculated here are the most, they're the ones calculated from time 1 baseline sample. And even at time 1, not everyone completed the diary. So these are the worst of the worst, which normally people don't present, but I wanted to show you exactly what you're going to get into with these data sets and the fact that they're still pretty good in light of everything that was going on. Just giving a brief overview of kind of what we have in HARP, we have many, many measures. But our main constructs that we're focusing on are marital dynamics, psychosocial risk and resilience factors, health, well-being, and health behaviors. And one of the things that we were very intentional throughout the project is maintaining as much as we can longitudinally. So we really were careful not to cut too much or to add too much at later waves or earlier waves. So the main thing we did end up adding that's new, that's not available at 3 waves are cognition, so cognitive impairment, caregiving, and a pain scale and end-of-life planning. So those are the newer ones that are only available at later waves, but by and large, there's plenty here. And a lot of what we've published from this has been cross-sectional since we just wrapped up time 3. So there's a lot of opportunities here to look at these constructs longitudinally. And it's a really clean data set for doing that. So it's really also good for a little plug for master's theses and dissertations if you're a student. The diary has similar constructs, but the way we talk about them is a bit different. So we still ask daily marital dynamics, daily stressors and support, daily health, well-being, and health behaviors. And the difference is how we ask them compared to the baseline. So for instance, cognition at the baseline, we might ask, how is your memory overall? And then the responded answers. Whereas in the diary, we ask, in the past 24 hours, have you gone into a room and forgotten why you went in there? Have you forgotten a word that was on the tip of your tongue? So it's the constructs overall are similar, but the measures are very different between the 2 data sets or the types of data. A brief plug to access the data. It's all publicly available at the ICPSR Data Consortium, and this is completely updated and cleaned data set. We've made a lot of efforts internally as a team to get these data as clean as possible so that anyone can use it, and we encourage people to use it, and they're not hampered by it being difficult to work with, hopefully. So the baseline and diary data is all available at all 3 waves. It's available in a variety of statistical packages. Again, this is only married couples. And one of the key things is you do not need pre-approval from anyone on our study team to use or publish with these data. You're welcome to browse our website because we have all of our publications listed on there to see what's been published. But like I mentioned earlier, a lot of what's been published is the cross-sectional or with 2 waves of data, since the 3rd wave is brand new. A plug for our website. We put a lot of effort into having our data page on our website very informative. So we have this about the data, but underneath we have an overview which has detailed information about our response rates, our measures, constructs, the variable names in the data, and how HARP compares to national estimates, generally speaking. All of our questionnaires, code books are there, information about getting data access and citing the data, and then a lot of commonly asked questions that we get. So what certain variables are in the data, how do we work with certain things in the data, and all of that is on there as well. So that's a good resource for you all. So just another quick plug. Here's where our data is. It's available. It's ready to use. I'm biased, of course, but I think it's easy to use and fun to use. Go to our website, learn more about us, and then reach out to me with any questions you have. I'm happy to send you links of any material you have. We are very much pro open access. So anything I have that I can send to you while protecting our participant confidentiality, I definitely will. So thank you, and hope you enjoy the data.
All right. Good morning, everyone. My name is Yiwen Wang. I am assistant professor in the sociology department at ECF. I got my PhD from UT, and I have been using HARP data for about 6-7 years now. So I'm a heavy HARP data user. Today, I'm going to talk about the HARP baseline data, specifically the types of research questions that are best suited for baseline data, some common challenges in working with the data, and how we can address them. So by now, we already sort of know the strength of the HARP data, right? They are dyadic and longitudinal. They have rich information on both health and marital dynamics. More importantly, we have reports from both men and women in same-sex and different-sex marriages. And that allows us to compare health and relationship dynamics across different marital contexts. So with 3 waves of baseline data, we're able to ask a wide range of research questions. For example, how do marital dynamics and health change over time? Or how do marital dynamics shape changes in health and health-related behaviors? For example, does marital strain affect alcohol consumption or depression levels over time? Or we can ask in the other direction. We can ask, how does health shape changes in marital dynamics? For example, does having a sick partner and doing care work for them change your marital quality over time? We can also focus on spousal interdependence, looking at how spouses influence each other's health and behaviors. For example, we can look at how one person's stress may cross over to affect their partner. And we're also able to look at the health and health behavior concordance or discordance between spouses because we have reports from both spouses on same measures in the data. And for all of the questions here, we can further ask, how do these processes differ for men and women in same-sex versus different-sex marriages? And here I have a list of publications that used Wave 1 baseline data. And most of the work here focuses on health behaviors, marital quality, discrimination, coping strategies, and sexual experiences. For example, some of the early works looked at how spouses monitor each other's health and care for one another in marriage. And others looked at how spouses provide emotional support and cope with stress together. And it's important to note that all these studies here only used Wave 1 baseline. And we have multiple waves available now, which means that many of the questions here can be revisited using a longitudinal framework. And we also have a few recent studies that used Wave 2 baseline to look at cognitive health among those aging couples and how they plan for the end of life. As Sarah mentioned, those are some measures we added in Wave 2, and probably we kept them in Wave 3 as well. So here I have highlighted some baseline measures in purple that I think are relatively understudied in baseline. In particular, we added several caregiving measures in T2 and T3, and they haven't been fully explored yet. And overall, we just really need more research to look into the longitudinal dynamics of all these measures here. All right, what are some main challenges of working with HARP data? I think data modeling is perhaps the biggest challenge here because HARP has a very unique data structure. It is dyadic and it has both distinguishable and indistinguishable dyads. So the different sex couples are distinguishable dyads based on their gender, but the same-sex couples are indistinguishable dyads here. And to analyze the data, we need to account for the interdependence between spouses in the data, which means the spouses' scores are often highly correlated because of assortative mating and their shared environment. So we need to account for that non-independence in the model. And in addition, we have indistinguishable dyads like same-sex couples in the data. So we need to apply additional modeling constraints to properly set up the variance structures in the analysis. And to address all of the issues here, we typically apply an actor-partner interdependence model, the IPIM model, to the data. And we usually do it in a multi-level modeling or structural equation modeling framework. So both models would work for the data. I'm not going into details about the methods because it's not something I can explain in 10 minutes. I wish I could. But I do have some resources here for those who are interested in learning the method and using innovative dyadic data like HARP. I personally find the Kruger and Powers piece very helpful. They explain the approach very clearly, and they also provide data and R codes in that chapter so that you can easily adapt and apply to HARP data. There are also some common issues that reviewers often raise when you are trying to publish using the HARP data. The first issue relates to data limitations, because we have a selected sample of relatively advantaged couples. The participants we have here are cisgender, and most of them are white and highly educated. And they're a mix of boomers and Generation X. So the findings cannot be generalized to the larger population. And I think that's something important to keep in mind and be sure to acknowledge in the limitation section. And with 3 waves, attrition and missing data can also be concerns. In general, using structural equation model may help address some of those missing issues. Like if it's missing at random, then SEM can help address that. But it's still something we need to carefully consider if we're using it longitudinally. Well, despite the challenges and data limitations, I still think the HARP data provide a unique opportunity to study the cumulative effects of marital dynamics on health, as well as how relationships change in response to those health dynamics as people age. There are so many important and exciting questions to be explored in HARP data, and it's not just the baseline component. So Michael will talk to us about the dairy component in a minute, and it's possible to link all the baseline and dairy data and study all those processes longitudinally. Okay, that's what I wanted to share about the HARP baseline. I'm happy to take any questions at the end. And if you're interested in using the data or thinking about potential projects, I love to talk and help in any way I can. Thank you so much for interest.
Thank you, Ewan. And now Michael Garcia is going to talk about the diary component of the study.
Thanks, Deb. Hi, everyone. My name is Michael Garcia. I'm a social scientist at Far Harbor Research and Evaluation and a proud HARP research team alumnus, as evidenced by my long-term use of our great water bottles we sent to participants. I'm super excited to be here. And as Ewan said, I'll be talking about the HARP diary data, the questions that can be answered using the data, and then also some unique challenges that come along with it. So starting off with some questions that can be answered with the HARP data. As has been discussed, we collect data from both spouses, which helps us move beyond the individual to treat the relationship as the unit of analysis. And something that's really unique and special about the diary data is across this 10-year span, it allows us to treat the daily diary bursts at each wave as a kind of microscopic view into each couple's life. Kind of helps us answer, was it just a bad day, or is it something larger that can contribute to long-term health? And so one of the first kind of big buckets of research questions that can be answered with the diary data is dyadic crossover and contagion effects. You can look at how one spouse's daily stressors or health fluctuations immediately impact their spouse's health and well-being on a day-to-day basis. We also have this really unique and I think interesting opportunity to link micro dynamics of health and stress and marriage to macro level trajectories. So we can look at whether negative daily interactions between spouses predict long-term change in marital quality, health, or even relationship dissolution. And then with the longitudinal aspect, we also have a bucket around aging and just the evolution of support within couples. We see, using the diary data, we can see how couples age from midlife into later life, how their daily dynamics, including spousal caregiving, emotional support, and shared health habits evolve along with them. And so thinking about what we have published with the HARP diary data, similar to as Ewan mentioned, a lot of it is the wave 1 data primarily. We've looked at daily stressors and their impact on well-being, daily marital support strain, how it influences daily processes, including memory, alcohol use, sleep quality, and psychological distress. We've looked a little bit at distress transmission and contagion across couples. And then we've also looked at the interactions between marital stress, motion work, and childhood adversity. I did want to highlight the journals, some of the journals that we've published with the diary data. You'll see that a lot of them are very actually all of them are very well respected top specialist journals, and really just wanting to try to highlight that this data is highly publishable and there's lots to explore. So thinking about what's missing with what has been published so far with the HARP diary data, I'd like to really zoom in on the micro level processes influencing this kind of macro level health and well-being and relationship functioning. We have a lot on the time one diary data, but we really have just started scratching the surface on how we can use the diary data across all three waves to look at how these micro level, day-to-day interactions, they have cumulative effects. And a lot of times with larger surveys that just do global measures, you can't really get into that fine-tuned nature that we've been able to capture with the HARP data. We also haven't looked too much at how the daily dynamics evolve as couples age together. There's a lot of research, aging research, thinking about how things like stress reactivity change over time. And so the HARP diary data is really, really rich for looking into these things. Here I use the example of, do couples get better at shaking off daily arguments as they age? And then another opportunity that we have is as Sarah and Ewan mentioned, we have added some different measures, improved diary measures at time 2 and time 3. So we can use that as an opportunity to update and expand on the HARP studies that have already been published based on the time 1 diary data. I'm thinking specifically, we have one paper looking at exposure and reactivity to daily stressors. And now that we have the time 2 and time 3 data, which incorporates stressor severity, we can really build upon that study. And I think which would be a really unique and interesting way. I wanted to give a quick example of how we could use the HARP diary data to explore some longer term health outcomes. So this is kind of using that study I was just talking about as a base, thinking about exposure to daily stressors and how it impacts individual psychological distress and well-being. So we can take that study as a base and use that to capture what we can call emotional reactivity. So then we use this with in-person variation between the association between daily stress and daily well-being. And we can use that to predict longer-term health outcomes, for example, depressive symptoms. And it's a really interesting way to see how these kind of daily micro-level interactions do have impacts on long-term health and well-being. And if we really want to get crazy with it, we can add some moderation effects or interaction effects to see how, in this example, how different levels of support, how couples support each other through times of stress, both positive and negative support, might moderate that sort of daily level micro interaction relationship with this kind of macro level health and well-being. It does get a little tricky in terms of the number of interactions, but I swear it can be done. That kind of sets me up well to talk a little bit about the challenges that we have with the diary data. In addition to those mentioned by Ewan, the diary data is highly nested. We have days nested within individuals, nested within couples, and then measured across multiple waves. That's a lot. I promise it's not as scary as it sounds. Also, as I talked about with kind of the moderating effects and the approach that we take using the APIM model and the factorial method, you end up with a lot of interactions, which at the surface can make the results a little difficult to understand. And then also we have missing data. There's missing diary days within individuals. At time 2 and time 3, we did have some instances where one spouse within a couple ended up completing, but the other didn't. And then, of course, we have some bias involved in terms of couples who facing divorce, separation, and widowhood. But there are solutions. Like I said, it's not as scary as it looks. Stata and other statistical software is highly capable of handling this complex data structure. Usually using the mixed effects models. I think Ewan mentioned the Rhiannon Kroger and Dan Powers. Their publications are super helpful to use as a resource that help kind of demystify the data and that even provides example codes to help get you started. And that factorial method really does help disentangle these dyadic gender effects. I found that margins are truly your friend with this data. We recently had a publication process where the editor and I disagreed a little bit on how useful it would be to show 11 interactions in one model, but we came to an agreement with a supplement and things worked out great. But without margins, you would probably have a bit of a tough time explaining what each individual coefficient was contributing to the model. And last thing I wanted to end with as well is just talking about if you just want to get your feet wet, if the idea of the nesting structure of the days within the individuals, within the couples, within time is a lot. You can even, one thing that you can do to just get started is you can use the diary measures and average them across an individual and almost make some sort of a pseudo baseline measure. This kind of helps go beyond, maybe a global self-rated health measure to be able to see lived experiences of health, well-being, stress, marital dynamics, aggregate it up, and then use the data that way to predict different baseline outcomes. So that's a good way to get started, but I'll say it again, it's not as scary as it looks, I promise. And I do want to highlight too, I think the diary data in particular is underutilized so far in HARP, and it's so rich. It's very obviously highly publishable, and I'm really excited for folks to keep digging in. I want to give a quick shout out, of course, to Dr. Deb Umberson, HARP Director and Dissertation Super Chair, my colleague Sarah Murnitz, who is the HARP Project Manager and also a fellow Bravo lover. So we bond a lot over that, and then the entire HARP team, past and present, of course, including Ewan. And then our funding from CAPS and, of course, NIA. Plug for the HARP website again. And then I'll include my contact info here and we can share it. If you have any questions, I'm happy to talk about analyzing the diary data specifically, HARP overall, would be happy to discuss the nitty-gritty code, anything I can help with. So thank you all for listening. I'm excited to hear what questions you have.
Thank you. Okay, you guys can see why I have such an amazing team. Thank you so much, all of you. All right, so let's open it up to questions about anything you want to ask in terms of the use of the data, topics, methods, whatever. So please just jump right in.
Thank you so much for this overview. This makes it less intimidating, venturing, diving into this. Would you be able to give some information on, what are the themes that were covered in the qualitative data? So I think I'm interested in subjective age, and any interview on aging, people talk about their anxieties about aging or how old they feel. I'm curious if those themes came up in the baseline qualitative interviews.
Well, yes, a lot comes up about how people age, and it does vary across the couple types, the way people talk about it, in terms of it being a shared experience, in particular for gay and lesbian couples, as opposed to a kind of divergent experience for the straight couples. And I know we have at least one qualitative publication that addresses that. I don't think I can say a lot more about that. And the qualitative data we have not made those publicly available, in part because it's so difficult to de-identify the data.
Thank you.
I don't know if there are specific measures that maybe get at that issue. Does anybody know about any? I can't think of any.
Hi, everyone. Yeah, quick question here. Sorry. Yeah. So great to see everyone. Yeah. So my question, I have a lot of caregiving projects going on. So I want to hear about the understudy caregiving part of the project. Thank you. Yeah, so no one has really looked at caregiving. And in the caregiving module, we ask about hours of caregiving they've worked, if the spouse helped with the caregiving at all, and just the stress of caregiving, basically. And I may be forgetting something or not, but that was the gist of it. And as far as I know, I mean, do either Ewan, do you know anyone working with caregiving? I don't think anyone has, or Deb.
No, I just took a quick look at the measures last night. We also asked like who they cared for, like the first person, the second person, and how many hours did they do that, and how did their spouse help them with that care work. And I think our sample sizes for those questions are a little small, like it was around 100 people, individuals for those questions, the hours of care work.
Yeah, and I will say in doing the code book, there's not a lot of there's spousal caregiving and parent caregiving, and there's not a lot of like other caregiving types with children or other friends or anyone else. So that's really what you'd be looking at with those data.
We do have questions about relationships with family and friends that might be relevant in some cases. Another thing you could do is link the caregiving to the diary data. So you could identify people who are doing caregiving and look at how their daily dynamics maybe differ from other people's, which could be really interesting, I think.
Thank you.
I had a question about just if from the data, were y'all able to draw any clear correlations between like just overall well-being and just interactions between spouses and how, how it interacted with marital dynamics and stuff like that?
Yeah, I can jump in a little bit, I think, there. Some of our papers have focused a lot on the diary papers, at least, on daily marital dynamics and well-being. I can say for the ones I've been a part of, we often find there to be gender effects in a really interesting way. I know a lot of previous research kind of shows that women may be more reactive to marital strain or daily stressors. What we found with the HARP data is it's actually this combination of women being married to men. Specifically. So we have this sort of individual and spouse gender effect combining to really maybe not surprisingly, disadvantage women who are in different sex relationships. So I think that's popped up a lot in the papers I've been involved with. I'm interested to hear about others' experience as well.
Can I ask something? Hi, thank you for the talk. I wanted to ask, first of all, if you have data about the relationship these couples have with their children, if they have any children. What kind of data did you collect about the intergenerational aspect?
So this is something that we have not looked at all. Sarah, can anybody talk about the specific measures we have? I know we have parental role strain measures. Yeah, go ahead, Sarah.
Yeah, so in addition to like whether their kids are living in the household or not, the age of the children, we ask if they're satisfied being parents, if there's, I think, like if it causes stress on their marriage to be parents, if they're happy with the way their children have turned out, and I believe one other item relating to that. And you might think it's like a completely rosy picture, but there is definitely variability on those measures. My favorite measure, just to like look at descriptively, is that if they're happy with the way their kids have turned out, because that's a bleaker picture than you might expect in an unexpected ways. I mean, most are happy still, but there's more variance there than you would think.
That additional measure, I think, is how often are you bothered or upset as a parent?
Yeah.
That in there too. And I think we have support and strain in relationships with kids, whether they're in the home or out of the home, right? Don't we have
I mean, in the diary, they have as well, like if they've had a pleasurable or negative reaction that day. And one of the options of the with who is kids. And so that gets a fair amount of action there too, I would say. So that's like the diary measure with parent-child interaction.
And the questions are about kids in general, or did you ask about each child separately if they had more than one?
So it's about kids generally.
Okay.
Yeah.
And can I ask another question?
Yeah.
You mentioned the early life adversities. Can you tell a little bit more about what kind of data you gathered there?
So those are like the ACE, the childhood adversity scales. So it's things that they've experienced before 18, everything from like parental divorce, abuse instances, like there's the spectrum, but it's any adverse experience before 18.
Okay. Thank you.
Yeah.
Alaya, yeah, or
Hello.
Elia, sorry, you don't know how to pronounce your name.
Hello, everyone. Thank you so much for giving this talk. It was very helpful. I have two questions. One is about, do you have any information on employment status or occupation? Because that was potentially related to something I had in mind.
Yes, we do. We ask about employment, we ask about income. It's more income at the later waves. Employment, they had a write-in question at time 1. I will say, given the age range, there's like a fair amount who are starting to retire at the later waves. So, but that's reflected that, like you can see in the income measure. So we ask about individual income and then household income as well as kind of for that. And I think one of the grad students, Jamie, may have recently published with the income because they're really interested in like income discrepancies and between same and different sex couples. And so I'm not exactly sure. Jamie's on the call here. So if you have published, you can plug your publication now, but we're talking about.
Hi, I'm sorry. Sorry for jumping in. Hi, everybody. I'm Jamie. I'm also part of the team. I didn't really publish on like income, generally speaking, but I did publish. I haven't published anything with my dissertation yet, but I'm working on it. And one of it is particularly about financial stress and how that impacts different across diverse families. And yes, we do have employment status as one of the variable. And we also have a lot of measurements with regard to like income. And I think sometimes we use like a ratio of household income as a control, but you can definitely do some kind of like different, you can definitely see that as kind of a outcome if you're interested in that, right? Like who's contributing more to the household income and everything, and how that kind of affects various of other outcomes that you might be interested in. And I think that's a lot of potential to work on as well.
Are there any measures of work-related stress in our diary? So that could be a cool thing to bring in from the diary and link it to the survey.
Yeah, so the diary, they have just like if you've had basically like a work interaction that wasn't good and then the stress of it, basically.
And an unrelated question that was my second one was, so you've mentioned that you have, I think, provided weights, but that there were like concerns or challenges related to like attrition or missingness, and or that some reviewers have been occasionally concerned. So has the project decided to, like, say, keep a more flexible approach and let individual users decide how to handle that? Or have you provided like a solid set of weights, but sometimes reviewers aren't super happy about it? Or were you more referring to like challenges with like including weights and attrition into the statistical methodologies? Could you all elaborate a little bit on all of that?
Ewen, is that something you can elaborate on?
Well, I don't think we have weights, do we? I mean, correct me if I'm wrong. None of us has published it longitudinally so far. We're just anticipating those potential challenges here. And you honestly don't have to use it longitudinally. You can use like for example, a predictor in wave 1 to predict some health outcomes in like wave 3. You can use it that way. You don't have to use exactly like a growth curve model or something like that. And I think that way you can avoid those attrition rates properly.
So y'all have cross-sectional weights, but not longitudinal ones.
No, we don't have weights created because it would be so specialized depending on the research question, given the sample size and everything. So it didn't make sense to create ones and then force people to use them that way. But you're more than welcome. We've never had a reviewer ask for weights on any of
Good.
our, like, correct me if I'm wrong, but I never have in anything that I've been a part of involved. But certainly maybe with the 3 waves, that could be something that comes up, and we might, we've deposited the data, but we can always add to it. And if that's something that there might be utility for down the road and it keeps consistently coming up in the same way, publication, then we can maybe talk about doing that down the road. But as of now, we haven't needed to, so we haven't.
All right. Thanks everyone for clarifying.
Does anybody else have any specific questions about content? Maybe papers you're thinking about writing or dissertations you're thinking about doing, where you want to know something specific about content?
I will take that opportunity to plug that. The data is so rich. It is incredibly easy to come up with a 3-chapter dissertation focused solely on the HARP data. And you could probably come up with like a 10+ chapter. So as someone who did their dissertation focusing on HARP, it was really a useful data set to use. Oh, and I also wanted to comment back on earlier the comment on children. Wanted to mention we have some analyses where we did look at there's a measure that just notes children in the household, and we did look at some interaction effects there, and somewhat unsurprisingly found that there is an effect specifically in relation to stress. And stress reactivity and how children in the household might exasperate that, and bringing in the kind of dyadic gender lens as well. We found that interaction was strongest for women in different sex marriages.
I will add too, that reminded me, thank you, Michael, that with the children, there is some differences there between couple types. So like in our different sex couples, almost all of them have kids. It's like extremely high prevalence, about half of the women with women, and then about only 25% of the men with men. So if you're really interested in disentangling some of the like gender couple type differences with some of the children in the household, there may be interesting things to find there, but there may also be some like variability issues that you might run into. I can't say for sure, but just a heads up.
Yeah, and certainly this is one of those places where, our cohort is unique. Like a lot of the men in our in-depth interviews, for example, men married to men, said that if they were younger or if they'd grown up in this era rather than the era they grew up in, they would have had children. But most of the men married to men who have children have them from previous relationships with women in this particular cohort.
Thank you.
We have a question in the chat about, are there bisexual couples? It's mostly same and different sex, but sexual identity is asked. So sexual identity is asked at time 1. They're not huge cell sizes for bisexual couples. Part of the reason we did the supplement project was to get the interviews for where a partner is bisexual so that we could kind of roll out a replenishment with bisexual couples involved. Of course, that was like well before the whole funding drama, and so there's no immediate plans to do any replenishment or anything like that. But all that to say, like, we don't have a ton of bisexual couples in which you could compare. I don't know if we have a single bisexual male, for instance. I know we do have some female participants who are bisexual who are married to men or women in our sample, but there's probably not a lot there to do a bisexual project.
Okay, last call.
We have another question from the chat about most of the children in the household are young adults. Not necessarily. We do have some young kids who are, I would say, elementary age and older. We do have, given that they were 35 to 65 at time one, there is a range. Most of them cluster probably like high school, young adult age, but we do have some as young as elementary and as old as like midlife themselves. So there is a range there.
All right, well, I would like to thank my panelists, and I would like to thank all of you for attending today. If you have any questions at all, please feel free to reach out to any of us. And again, join our network on sexual minority aging if you haven't done that already. And we look forward to seeing your future publications with HARP. Thank you for being with us today.